Good day everyone, I am Ariely Nicole and this is my discussion video for my midterm requirements in parasitology. I choose the parasite Schistosome because I always heard about it a lot. So, let me begin. Schistosoma is a genus of trematodes, commonly known as blood flukes. They are parasitic flatworm responsible for a highly significant group of infection in human termed schistosomiasis, which is considered by the World Health Organization as the second most socio-economically devastating parasitic disease, after malaria, with hundreds of millions infected worldwide. Schistosome cause schistosomiasis in human are also known Sixto disease. This parasite have a complex life cycle that involves freshwater snail as intermediate host. Now, let me tell you where scientific classification schistosome belong. So, it belongs to the domain Eukaryotes, kingdom Animalia, phylum Platyhelminthes, class Trematodes, order Diplostomida, family Schistosomatidae, subfamily Schistosomatinae, genus Schistosoma. Schistosome, the parasite that causes schistosomiasis, right? And it shares several common characteristics. First is blood fluke. Schistosomes are also known as blood fluke because they live in the blood vessels of their host. Second is complex life cycle. They have a complex life cycle that involves several stages and requires both freshwater snail and a vertebrate host, such as human or other mammals. Third is sexual dimorphism. Schistosome exhibits sexual dimorphism, meaning males and females have different physical characteristics. The male is larger and more elongated, while the female is shorter and thicker. Fourth is hermaphroditic. Although they have separate sexes, schistosome are hermaphroditic, meaning each individual contains both male and female reproductive organs. Fifth is schistosome has the ability to penetrate the skin. The larvae of schistosome have the ability to penetrate the skin of human and other mammals, which is how infection occur. Sixth is mammalian host specificity. Different species of schistosome has a specificity for different mammalian hosts, although some species can infect a range of mammals. Lastly, inflammatory responses. Infection with schistosome often leads to an inflammatory responses in the body, as the immune system reacts to the presence of the parasite in their eggs. Next, let's proceed to the life cycle of schistosome parasite. Schistosome life cycle involves human, certain species of snail, and fresh water. Infected human passes schistosome eggs via feces or urine into the fresh water. Egg hatches into larvae and infect freshwater snails. Larvae develop into the snail then release back into the water in a form of called cercariae. Cercariae swim and penetrate the skin of a human. Once in the body, they swim through the bloodstream and enter the lungs. They then travel into the liver when they mature into adult worm. In the liver, male and female worm pair up and migrates into the blood vessel and surrounding organs, producing thousands of eggs, some of which end up in the water, continuing the cycle. Now, let's proceed to the epidemiology of schistosomiasis, which is caused by schistosome. So, schistosomiasis is prevalent in tropical and subtropical area, especially in poor communities without access to safe drinking water and adequate sanitation. It is estimated that at least 90% of those requiring treatment for schistosomiasis live in Africa. Schistosomiasis mostly affect poor and rural communities, particularly agricultural and fishing population. Women doing domestic chores and infested water such as washing clothes and also at risk and can develop female genital schistosomiasis. Inadequate hygiene and contact with infected water make children especially vulnerable to infection. Migration to urban areas and population movements are introducing the disease to the new area. Increasing population size and the responding needs for power and water often result in development schemes and environmental modification facilitate transmission. With the rise in ecotourism and travel to remote areas, increasing numbers of tourists and contracting schistosomiasis. At times, tourists present several acute infections and unusual problems including paralysis. Urogenital schistosomiasis is also considered to be a risk factor for HIV infection, especially in women. Now, let's proceed to the schistosomiasis symptoms. Symptoms of schistosomiasis are caused mainly by the body reaction to the worm's egg. Intestinal schistosomiasis can result in abdominal pain, diarrhea, and blood in the stool. Liver enlargement is common in advanced cases and is frequently associated with an accumulation of fluid in the peritoneal cavity and hypertension of the abdominal blood vessel. In such cases, there are also be enlargement of the spleen. The classic sign of urogenital schistosomiasis is hematuria, blood and urine, kidney damage and fibrosis of the bladder and ureter, and sometimes diagnosed in advanced cases. Bladder cancer is also possible complication in the later stage. The economic and health effect of schistosomiasis are considerably, and the disease disables more than it kills. In children, schistosomiasis can cause anemia, stunting, and a reduced ability to learn, although the effect is usually reversible with treatment. Chronic schistosomiasis may affect people's ability to work and in some cases can result in death. The number of deaths due to the schistosomiasis is difficult to estimate because of hidden pathologies such as liver and kidney failure, bladder cancer, and ectopic pregnancies due to female genital schistosomiasis. Diagnosis of schistosomiasis through the detection of parasitic eggs in stool or urine specimen. Antibodies and/or antigen detected in blood or urine samples are also indication of infection. For urogenital schistosomiasis, a filtration technique using nylon, paper, or polycarbonate filters is the standard diagnostic techniques. Children with S. hematobium almost always have microscopic blood in their urine, which can be detected by chemical reagent strips. The eggs of intestinal schistosomiasis can be detected in fecal specimen through a technique using methylene blue stained cellophane soak in glycerine or glass slides, known as the cat-to-cat techniques. In S. Mansouri transmission area, the circulating cathodic antigen CCA test can also be used. For people living in a non-endemic or low transmission areas, serological and immunological tests may be useful in showing exposure to infection and the need for thorough examination, treatment, and follow-ups. Preventing schistosomiasis involves avoiding contact with contaminated water in areas where the parasite is common. This can include, first, avoiding swimming, wading, or bathing in fresh bodies such as lake, rivers, and stream where the parasite may be present. Second, drinking safe water from reliable resources such as boiled or treated water. Third, proper hygiene, such as washing hands with soap and water before eating or preparing food. Treatment for schistosomiasis usually involves medication that kills the parasite. The most commonly used medication is praziquantel, which is effectively against all forms of schistosomiasis. Treatment is typically administered as a single dose. Although multiple doses may be required in some cases, it's important to note that treatment does not prevent reinfection, so avoiding contact with contaminated water is still important even after treatment. That would be all for schistosome parasite discussion. Again, this is Ariali Nicole D. Amindalan. Thank you.